Welcome to Planet of the Associations. I'm Seth Kahn.
And I'm Mark Levy.
And what are we doing here, Mark?
Yeah. So Planet of the Associations, right? It's about the association of the future, not the far future, the near future, X+3, the future for associations 3 years from now. And today we are speaking about something you are particularly expert at, and that is about the creation of social movements. How do you go about creating a social movement, particularly from the point of view of an association? So social movements, take it away, Seth.
Well, what is a social movement? A social movement is when many people pick up the cause and run with it. So the idea is that if you get 1,000 people to do something small, you can have a big impact. So that's why you want to create a social movement. The challenge is creating it around something that actually you care about, a result that you want. People do social movements around crazy stuff all the time, right? Like what song is the next big song? Like nobody really knows, right? Or what's the next big TV show? Nobody knows. Or why is everybody into QANON? Nobody knows. It's like, where do these things come from? Well, we want to be able to create a social movement around something that we do know what it is in advance. And that's the challenge, because it's not a cause and effect kind of thing. It's not linear. What you got to do is you got to get something to go viral. And by that, I mean, you have to have many minds pick it up and say, I want to run with this. So what we know is that there are principles around things that people like to run with. And some of it is very structured, right? So for example, Dr. Christina Economos studied 4 social movements in the United States: recycling, breastfeeding, tobacco cessation, and seatbelt usage. And she figured out that there were 10 key elements that they all had. Now, I'm on the spot to remember those 10 key elements. So here we go. In creating a social movement, these 10 key elements are not they're not sufficient, they're necessary. And that's a really important distinction, right? You know about necessary and sufficient, right?
No.
Between the two? Oh, I guess that's a math thing. We learn about that in mathematics.
Oh, okay.
So if something's necessary, it means it's required. You can't do it without it. But if it's sufficient, it also means it's all that's required. You can go once you've got necessary and sufficient. But you can have something that's necessary but not sufficient, which means that it's required, but there's other things that are required too, right? And then, of course, you can have things that are not necessary, which are by definition not sufficient. Because, well, no, is that true? If it's not necessary, it could, in other words, you could do it this way or you could do it that way. So they could still be sufficient, right? Like you could say, in order for something to be a card in a card deck, right, it must be black. Well, that's not necessary. But if it's red, that would be sufficient. If it is red, it's a card in a card deck. So anyways.
This sounds like an extremely advanced Abbott and Costello routine.
Who's on first? Is that
right, exactly.
Was that Abbott and Costello?
Yeah, absolutely.
Yeah. Okay, great. And who is the straight man? Was it Costello?
No, Abbott.
But Abbott!
Yeah. And they're both from New Jersey, by the way, which is,
are they?
I lived for like 30 years. Yeah.
Yeah. New Jersey spawns a lot of interesting. Go ahead.
Yeah. No. So I'm interested in social movements because also I'm interested in the fact of the idea of creating a social movement seems kind of odd. It's like creating an eclipse. It seems like something in the past that would have happened on its own. So when did manufacturing social movements come into existence? And this may not be something you know. I mean, I don't know. I'm just asking the question. Anyone out there who knows when social movements first were manufactured, you win a free T-shirt or something like that. Like when was it manufactured and why? And because, right, it just seemed maybe in the past, a social movement was just so large that it didn't seem like it could be manufactured, but maybe because of the tools of the internet and so forth and mass communication and, phones, mobile phones, like it became a bit easier to do. It actually became something that you could do. Like I could go to the supermarket and buy a pancake mix and manufacture a social movement. Those are both on my to-do lists for today.
Your to-do list, right?
Yeah.
Well, I think the internet has a lot to do with it because we're all connected now. and before we weren't, right? So it's actually possible. It's not necessarily true that you can, but each one of us could actually talk to any other human being who was alive at that moment using a cell phone, even if they were on the International Space Station, right? So you could conceivably talk to Joe Biden, for example, if you wanted to, or Putin, or anyone. We've got the technology to do it, which means that we are wired together. So now, for the first time, we actually have the tools to really create a serious social movement. Now, if you happen to be Hank Morgan, do you know Hank Morgan?
No.
He was the protagonist in A Connecticut Yankee in King Arthur's Court.
Oh, okay. Yeah.
He did go back in time and predict an eclipse. In fact, that was
right.
So that's one way to do it, right? You can come back after the fact and say, I predict that pet rocks are going to take off, right? Before they did. But if you can't time travel, we got to talk about time travel on one of our episodes. That's one of my favorite topics. Maybe even on this one later on. We'll see. Yeah. Then there are these 10 key elements. And so I'll just riff right through them really fast. So the first one is that you have to frame your movement as a crisis. A lot of people like to do something aspirational. The aspiration can be the flip side, but it's the crisis that gets people's attention. So it's got to be.
What would be, and I know you said you'll flip through them fast, but I'm not going to let you do that.
Okay.
What would be an example of framing a movement as a crisis? What would be framing a movement aspirationally and then the same movement framed as a crisis?
So we could frame that humanity is a sustainable relationship with planet Earth. It's aspirational. Climate change is coming and it's going to kill us all is the crisis.
Got it. Okay, cool.
Yeah. So it's whatever your thing is, it's got to be grounded in science-based research, and that science-based research has to be available to people. And that is what makes it possible for people to validate your claims without you being present. And that's key in a social movement. If you're controlling the information, if it's propaganda, then it's not going to catch. Unless it's like a cult, like, I don't know, we shouldn't go down that path.
Right.
People can use this for darker purposes.
Right.
There's coalition building. That's bringing together groups. So part of creating a social movement is that you're taking activity that's already happening in multiple places and you're linking it. That's probably part of what the internet makes possible, is that networked effect, right? There needs to be an economic case. It has to be better financially to do what you're saying than to not do it. If it's better financially to not do what you're saying, then you're in trouble. It's going to have a hard time catching. There need to be champions, people who can advocate for it. And you never know what kind of resistance you're going to find. It could be that you're breaking a moray. It could be that there's a law that you have to change. It could be that there's a process that's been a tradition that you need to overcome. Whatever it is, your champions or your spark plugs are the people who mount efforts to advocate to change that. And advocacy is one of the elements as well. And by here, we're not talking about lobbying your politician. We're talking about addressing wherever there's a challenge and really going after it. Does that make sense?
Cool. Absolutely.
The government needs to be involved, not because they want to be, but because there's likely going to be policy changes involved at the local, state, and federal level, depending on how ambitious you are. But if there's something that you want to do, it's better to get government people involved early on because policy making takes a long time. So you want them to come into meetings. And the way you do that is you find people who are sympathetic to your cause and get them engaged.
How quickly do you get the government involved? Right off the...
I do, yeah. Like when I worked with the American Nurses Association, we were looking to create a social movement around Healthy Nurse, Healthy Nation to measurably improve the health of America's 4 million nurses. We invited government officials to our very first meeting. We didn't yet know what policies would need to be changed. We had no idea, but we knew we wanted them there so that they could actually help us identify the policies that needed to be changed. It has to be easier to do the right thing than the wrong thing. I always think this is interesting. And that's often a physical phenomenon. For example, believe it or not, I emceed a 2-day conference on hand washing once.
I believe that.
You do? One of the things I do is I'm a professional MC, right? People hire me to come in and...
Oh, I didn't know that.
Yeah. So a lot of times I will lead a conference. I'll be the narrator. I'll pull it all together. I'll talk about the different elements, introduce the speakers, yada, yada, yada. So I did a 2-day hand washing conference, and people came from all over the planet who had evidence around the efficaciousness of washing your hands, especially if you're a healthcare worker. And the number of locations that they want you to wash your hands when you're seeing a patient in a hospital room is too many. And the reason is that if they stopped and washed their hands, and we're talking quick wash here, seconds, if they stopped and washed their hands at every place that was identified, they would have no time to do anything else in their day. They would, not just the patient, they wouldn't have time to go to the bathroom. They wouldn't have time to sleep. I mean, there's nothing, it's more than 24 hours a day. So what they had to do is they had to narrow it down to those places where it makes the most impact. And then where do they put the hand washing units, the sanitizers? On the patient's bed rail, on the door jamb, so that you can do it while you're doing something else. And that's what we talk about, making it easier to do the right thing than the wrong thing. Right? If you have to go to the sink, it's not going to happen.
Yeah. One of my clients is the daughter of the CEO of the organization that manufactures Purell. Oh. She had told me what a difference it made. This was pre-pandemic. A difference it made that they put the hand washing situations in points of transition. Oh. When you were going between rooms, when you were doing, like when there was a transition happening, when you weren't yet immersed in what was going to be happening in that room, you were segueing into something else.
Segue. I love that word.
What?
Segue.
Segue. Right. Right.
The transition. So, the transition.
Yeah. Yeah. Right. Well, because when you're in the room, now you're there for a specific purpose, and now hand washing becomes an annoyance. But if you're in a transitional moment, it just becomes like a ritual of getting to the next place.
Beautiful. Yeah. It's an add-on. It's a burden when you're trying to do something else. But when you're in the transition, it's part of that transition, just something that you do hopefully on autopilot at a certain point. Right. Here's another little tip. I'm taking a tangent from my 10 keys for a social movement about hand washing. I learned when you need to use soap and water and when you can use sanitizer. And it's very easy. If you can feel what's on your hand, you need soap and water. If it's invisible and you can't feel it, sanitizer will do the trick. Interesting.
Oh. Yeah. Okay,
so if you're getting rid of stuff, whatever that stuff is, oil, dirt, sand, you need soap and water. But if your hands feel normal, but you suspect you might have coronavirus or something on it, then sanitizer is what you want. Put that on.
Cool. Well, yeah. Thank you for that.
So back to the 10 key elements. So we went through 8 of them. Just really quickly, they were frame it as a crisis, science-based research, coalition building, an economic case, having champions, advocacy, government involvement, and then changing the environment so it's easier to do the right thing than the wrong thing. And the last 2 are you need a plan, you need a game plan, a strategy. People need to feel like if they're going to get involved in this thing, that somebody's running it and it's got a good chance of succeeding because there's a plan. And the last thing is you need a mass communication campaign of some kind. If you're trying to change the whole United States, like recycling did, then you need to be on every channel. You need to be on the internet. You need to be in the email. You need to be like everywhere on posters on the sides of bus stations, all that. But if what you're trying to do is reach people who you want to bring into the manufacturing workforce to build hydraulics and pneumatics, then your mass communication campaign will be highly targeted and a very small segment of the population. Those are the 10 key elements. So you put those together, you add in some passion, some fire, something that people actually care about, and some leadership to pull it all happen, and you're on your way to creating a social movement.
And what did you say before? Those are necessary but not sufficient, or sufficient?
That's correct.
Okay.
Yeah, because if I did all of that, let's say that my social movement was that I wanted everybody to adopt a new ring and wear it on their little pinky.
Right.
And so I did all of that, framed it as a crisis, all of those things. Still probably wouldn't catch because people don't really care about that.
Right. So as you go from one step of the 10 to each one, do you have to wash your hands between them?
No, because in fact, you don't do
transition.
You have to wash your hands all the time.
Right. So give us an example. So, right, how would we go about creating a social movement as an association? Like, is there tremendous self-interest involved?
Well, there should be obviously some self-interest involved because you're going to be dedicating significant resources to it. But you can't put yourself up as the poster child. If people, every business is in the business of taking money out of your wallet and putting it into mine. But you can't build a social movement around that. Nobody else will be involved in that. They'll say, no thanks. I don't want to put my money into your wallet. You have to have some value that is, worth the exchange. So when you're creating a social movement, there has to be a higher purpose, a noble purpose, as Lisa McLeod would say, the inventor of the noble purpose, right? And that's what you use to, not yourself. That's what you use to lead and spark the fire that creates the social movement.
So what are, because it could seem very daunting, obviously, right? Yeah.
It is daunting. Yeah.
Right.
It's hard to do. It's really hard to do.
Yeah. What are some first steps before I say first steps, it can be one of the first steps. How would people talk about it to their higher ups or the people in the association, or how would they sell it? What's the thinking involved?
Well, this is something that steps into your space, which is differentiation. They have to have a noble purpose that is fully aligned with the organization's mission. In other words, if the CEO hears about it and they realize if they're successful, it will move the needle. It'll get results in the domain of their mission, right? So, for example, Healthy Nurse, Healthy Nation, to measurably improve the health of America's 4 million nurses, run by the American Nurses Association. If the American Nurses Association could get that many nurses, or even a fraction of that many nurses, to become healthier, it will help their cause, because their cause is taking care of America. And they need to be healthy to do it. So if you improve the health of the nurses, they do a better job of taking care of America. That's an example of that alignment that we're talking about. You have to have them. If you are the lead building association, I don't even know what they're called, but I know there is one, and you pick up the noble purpose of climate change, people are going to be like, show me the connection. Like, why are you doing it? It's a good cause, but why are you doing it? Now, if you want to say, we are the organization that can teach you how to build and run a building so that it contributes to a sustainable future, well, now you've got the connective tissue and you can go with it.
So I think it sounds to me very much like that you have to be mindful, that you have to plan this stuff out in order to speak about it to people, that you shouldn't just wing it. That's something very commonly when I'm working with organizations, it's all about what's the script that everyone is going to memorize, not just the elevator speech, but what are all the facts and figures and stories around this single idea that you want to get out there that everyone's going to know. And it's not like a script, like you need to start at line A and then go to line B, not a linear script. It's just like a bunch of facts and figures and stories that all amplify a single idea that everyone should know. So it sounds to me like, based on what it is that you're saying, if you want to start getting people on board, you should be putting together, a bunch of these ideas. Would that be true? You should be writing your script.
Absolutely. So, for example, the American Nurses Association, notice how it just rolls off my tongue, to measurably improve the health of America's 4 million nurses and by extension, the rest of the country. But I also often will say, and by often, I mean like 90% of the time, did you know that in every category except for smoking, nurses are worse off than the average American? That's an example. That's the piece of my script, right?
Right.
It's true. But it's like I carry that around and it helps to create some context. And people, when you tell people that, they nod. People say to me, oh, right, I see all the overweight nurses. I see all the nurses smoking outside the hospital. I've noticed that nurses often look exhausted. They have these personal reference points that hook into that script and validate it. And then you move forward.
Right. What else would be part of that script that people would know for the nurses?
Like, what are some of the other facts that are...
or stories or so that would amplify that point that nurses need to be taken care of too?
Well, one of the things is that when we look at nurses making recommendations to patients on how to be healthy, if they are visibly unhealthy themselves, it impacts their credibility. So we know that. So if you're sitting in you're laying in a hospital bed You've come in because you had a heart attack, because you eat Big Macs every morning for breakfast, right? And then this nurse is standing over you and she's saying to you, you really got to change your diet, Mark. This is not working for you. And you look at her and she's 250 pounds. You discount what she's saying to you. But if she's 140 pounds, you're more likely to listen to her. That may not actually, it has nothing to do with the quality of the information the person is providing, right? A 250-pound nurse can provide the same quality information to you that a 140-pound nurse can. But your bias filters it out because you look at her and you say, oh, this person's overweight. She can't teach me about nutrition. So we know that. So we know if we make nurses healthy, and I'm using weight loss, but it's not just weight loss. It could be sleep exhaustion, could be stress. It could be, many things that are visible to the patients invalidate the credibility of the spokesperson.
Right. So you're saying that certain difficulties within the nurses would impact people's ability, them accepting what they're saying. So in other words, the nurse's health doesn't just affect the nurse, but the population that the nurse is dealing with.
Yes. And so ultimately, it's about the patient's health. That's the ultimate impact point. But if you back up into the system, the hospital's credibility is on the line, not just the nurses, right? If you're at Sibley Hospital and you have a completely exhausted nurse telling you need to get more rest, you don't think to yourself, Susan James doesn't know what she's talking about. You think to yourself, this nurse at Sibley Hospital doesn't know what she's talking about. And so that credibility goes right back to the employer.
Right. Yeah, this sounds incredibly important to me. To use an example, outside the realm of associations, just this idea of a script, because I just want to make, I want to not scare people off. I don't want them to do work that they don't need to. So when I say script, and the ideas you just gave are fantastic, that to create your cause, that you need a script that everyone like memorizes. It's not like a script about overcoming objections or so. It's to amplify a single idea. So I was working with an architect firm. I guess industrial architect. It was years ago. So if that's such a thing, industrial architects, right? So they built building complexes for like Pfizer and so, right? They didn't build houses. They built industrial parks and things. And so I said, what does the marketplace not like about industrial architects? What would keep them from hiring you? And the principal of the company said, they look at architects, businesses look at architects as unreliable business people, that they think we think of ourselves as artists, and we just want to build a building that's a homage to our artistic rigors, and that will go past your deadlines, will go past the money, your budget. We won't return your phone calls or your emails, nothing like that. We're just concerned with our artistic vision. So that is what would keep people from hiring us. And I said, okay, so what we need to do is put together a script of facts and figures and stories that shows you are reliable. With each fact and figure and story, just about reliability. That's all it is. Wow. So it sounded like this, putting together the script. It was the fact that we're industrial architects and we're very reliable. We opened our door. We've been in business for 20 years. In 20 years, we've done almost 4,000 projects. We have 214 repeat clients, including the first client who ever hired us when we opened our doors 20 years ago. The Lakewood School District is still our client today. On average, our repeat clients hire us for over 16 projects. On the commercial side, we deal with Pfizer, Bayer, Merck, Paul Miller, Bentley, Rolls-Royce. On the industrial side, we deal with the Mendon Police Department and the Wharton Fire Department. We have 24 people working here who've been with us an average of 7 years. We were voted last year one of New Jersey business best places to work in New Jersey. We have these certifications. We have these LEED certificates and blah, blah, blah. And even stories stories about how they are reliable. A very quick story. So I asked this principal, give me a story about being reliable. And he said, okay, I'll give you one very recently from last month. There was a guy who was not our client. He was a prospect. He's a client now, but he wasn't a client then. And he called me in a panic on a Sunday night. It was about 10 o'clock at night and it was raining hard out. And I said, what's wrong? Because he sounded panicked. And he said, tomorrow morning at 9, in other words, in 11 hours, I am going to be doing a closing, selling my building, my current building that my business is in. And then in the afternoon, I was going to take that money and roll it over and buy a better building in a better part of town. But I just looked at my closing papers right now. And I discovered that I'm supposed to have the physical dimensions of my building in my closing papers, the height and width and so forth. And I didn't realize that. I don't know what those figures are, and I don't know where to find them. And I'm scared that even though this just seems like a technicality, that my closing won't go forward in the morning, and then the closing won't go forward in the afternoon because I won't have the money to do it. And I could lose everything. So he said, he was freaking out. So the principal of the architect firm said, I will meet you at midnight at your building, bring an umbrella or a yellow slicker because it's raining hard out. So they met there and they went up in the elevator onto the roof, and the architect had brought a laser measuring device. And he just measured the width, the dimensions of the building, and he hand wrote it into the closing papers, and all the closings went off smoothly. So I said, great. So on that list of, we've been in business 20 years, we've done almost 4,000 projects, we have 242 repeat clients, blah, 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 all that stuff, have stories too. Oh, right. Let me tell you the story of so-and-so. And then go in that story and another story. So all this stuff, it's basically a list of points that you can brag about.
Right. They all are hammering this point home of reliable.
Right. And you don't have to say all of them. But I said to him, all the principals should know all these points, all the people pitching, all the architects or the draftsmen, the people answering the phone. Everyone should know this stuff. So when they're out at a bar and someone says something, they'll say, oh yeah, well, we were one of New Jersey's best places to work last year. We work with Bayer, and they should have facts that they can talk about to substantiate the point. And so everyone needs to memorize those things. And so it sounds to me like what you're saying when it comes to social movements, that people need such a list of facts, figures, and stories to get people on board as to the importance of what's needs to happen.
That's correct. Yes. And those are beautiful examples.
Yeah. How would they go about gathering such a list? What's a pointer or two?
Well, so remember I said that it's important to have evidence-based or science-based research. That's the place to go to. Where's the stuff that's compelling? Where's the stuff that's newsworthy about it? So we know in every category except for smoking that nurses are worse off than the average American. And by the way, I often add to that, and the average American ain't in great shape.
Right.
That's true too, right? So if you think about a nurse having to pick up an overweight patient, and the nurse themselves are severely overweight, you can imagine the physical risk involved. See, I just told a little story. That's like a mini story, right?
Right.
And so you want to have so you go to the science-based research. That's one of the first places. You also go to the media, find out what's already been covered, because that's already got human interest embedded into it. And you ask experts, because they often have lots of stories and lots of data points that are not widely shared that you can bring into it. There's also experience. I'll give you a quick example. I know that we were trying to get CEOs enrolled, and CEOs, one of the things we wanted them to do was to keep the cafeteria open at night, or at least have healthy options, because nurses were going and eating out of the vending machines and having a Snickers bar when they're working the midnight shift. And we would talk about, do you want somebody who has no food in their stomach except for a high density sugar treat, prescribing medications, running complex technology, writing up reports? I mean, this is the place where mistakes happen. So why not have a piece of chicken, some broccoli and brown rice in a saran wrap plate in one of those vending machines, refrigerated vending machine, or somewhere else where they can get a hold of it? The CEO saw the cafeteria as a loss center because they weren't able to make a profit in the middle of the night. We had to expand their scope to understand the implications of not feeding their nurses properly, so that they could see the financial risk that they were in by not having some option that was healthy available to their nurses. That's another example. That came from experience. I interfaced with the CEOs and learned about that firsthand, right? But now that becomes part of the story that I carry around with me. So that's another resource.
Right. The implications. I love that. Well, we are out of time right now. We're going to be talking more about social movements in future episodes of Planet of the Associations. I will see you next time. I'm Mark Levy.
And I'm Seth Kahn.
See you next time.